Hi, I'm Dr. Craig Kinnaperry. I'm a pediatric sleep physician at Yale University. Today I'd like to tell you 5 things that every parent should know about melatonin if they're considering using this medication in their children. Number 1, melatonin is a hormone, and it's produced in your brain by a gland called the pineal gland. And its function seems to be in regulating the body clock throughout the body. The primary way we think of the body clock is it's associated with the regulation of when you fall asleep and when you wake up. Although we know that melatonin does have effects in other tissues throughout the body as well. Because it's something that your body produces naturally, there's a widespread perception that melatonin is natural and thus it's safe. It is safe in that you can't really overdose on melatonin, no matter how high the dose is. However, it's important to recognize that it is a hormone and thus has effects all throughout the body. The long-term consequences of melatonin have not been studied well in children, although in the short term it seems to be fairly safe. Thus, it's hard to say for sure that continued long-term use of melatonin is not going to have side effects down the line that we're not aware of. Number 2. Melatonin is not regulated by the FDA as a medication. Rather, it's regulated as a food supplement. Thus, there's much less oversight in terms of the quality of the medication, the concentration of it, the documentation or labeling of the medication. There can be variation in terms of how well your child absorbs each preparation of melatonin, or variation in the dose from batch to batch, much less than we expect for something like ibuprofen. Number 3, melatonin's primary effect is actually that of a chronobiotic. What does that mean? Essentially, it has effects on sleep-wake timing. If you take melatonin 3 to 5 hours before you fall asleep, it is going to move when you fall asleep and when you wake up earlier. There are certainly conditions in which this is desirable. Another secondary effect of melatonin is what we call a hypnotic effect. What that means is if you take it 30 minutes before bedtime, some people will get sleepier and fall asleep. This is the capacity in which most families are using melatonin for their children. Number 4, melatonin has been studied extensively in children for conditions such as persistent chronic insomnia, autism, attention deficit hyperactivity disorder, and a body clock disorder called delayed sleep phase syndrome. In these contexts, melatonin seems to help children fall asleep more quickly and get more sleep at night, which is certainly a beneficial effect. Number 5, in many ways I think this is the most important point. Melatonin is not a substitute for good sleep hygiene practices in your home. Your children should have a consistent bedtime and a good bedtime routine every night. Their wake time should be fairly constant. Even for teenagers with insomnia, we usually recommend they not sleep in more than 1 or 2 hours later on the weekend if you can possibly avoid it. Except in younger children, napping in the late afternoon should be avoided. And it's also very important to note that exposure to screens, tablets, smartphones, televisions in the evening can affect when you fall asleep. Children and adults should try to avoid any screen time for an hour before bedtime, and children should absolutely not have televisions, tablets, or smartphones in their rooms. I've written a lot more about melatonin on my blog, so please go check it out if you have further questions. If there's anything I can help you with, please leave comments, and I hope this has been helpful to you. Thank you.